some closing remarks and some themes that George and Rob have heard that can kind of set us on our pathway forward and thinking about what we do in the future. And I just want to also mention that in this is part of the commitment from the administration that we will have another meeting and another symposium that will be really around how we translate this research into action. That will be with community partners, it will be with our education efforts, it will be with our facilities, and what we're really doing to impact this in really meaningful ways. So, again, look for that announcement and that information in the spring. So this particular panel, as you can see, is focused on environmental health and equities. I'll give a brief introduction and then I'll let them speak and give a bit of introduction to their own work. So a panelist, we have Philip Singer, who is assistant professor in political science. We have Scott Collingwood, who is a research assistant professor in pediatrics. And we have Daniel Mendoza, who is a research assistant professor in atmospheric science and is a fellow in pulmonology in the School of Medicine. And as a moderator, we have Adrienne Cashlin, who is associate professor lecturer, sustainability education director in environmental and sustainability center studies. Thank you. Okay, thank you. Okay, thank you. So I'll turn it over to Phil. Thank you.
Thank you for the opportunity to come and speak with you for a few minutes this afternoon. By way of introduction, my name is Philip Singer. I'm an assistant professor in the political science department. My background, though, is in public health. And I want to talk to you about a grant that is currently under development with some of my colleagues who you've either heard speak already today or will be speaking on this panel as well. And we represent a fairly multidisciplinary research team of backgrounds with political science, atmospheric science, medicine, and public health. And I want to talk about education and exposure to pollution and inequities that may arise from this. So we've been discussing this most of the day, but kind of with a focus on elementary age school children. 93% of the children under the age of 15 breathe polluted air that puts their health and development at serious risk. So that's about 1.8 billion individuals around the globe. Just more than a quarter of all deaths for children under the age of 5 is related to kind of environmental pollutants. We've discussed kind of the issues around Salt Lake City with ozone and short-term particulate pollution. And there's this connection between kind of exposure to pollutants amongst economically disadvantaged or minority populations and the health outcomes that they might have. So what we're interested in understanding is maybe the connection between kind of exposure to pollutants while you're in a school setting on kind of educational attainment or educational achievement. And we're particularly interested in understanding this with the perspective of if you talk to either one of my kids with this view of like school is a prison, I'm there for 8 hours every day, and they're sitting in a room and maybe they're being exposed to pollutants while they're sitting in these schools. So our main research question is that we're, as part of this grant that we're developing is, how does unequal exposure to indoor and outdoor air pollution impact educational outcomes with a particular focus on disadvantaged populations? And again, with a focus on elementary and middle schools here in the Salt Lake City area. So for data, we are wanting to install sensors at the schools, both indoor and outdoor, to collect air quality data, and kind of with a lot of variation around geographic and demographic composition that's currently existing in the Salt Lake City School District, which we'll talk about kind of some of those variation here in a moment. With a pollutants of interest, particularly with ozone and PM 2.5 concentrations. And our outcome of interest is chronic school absenteeism. Utah already has one of the highest rates of school absenteeism, and this is across like a wide variety of literatures, is associated with kind of poor educational outcomes. So when you look at, this is just a map of the Salt Lake City School District. It covers about 110 square miles, and there's a wide variation in kind of things that we might want to understand the effect on. There's about 600-foot difference between elementary schools in elevation range, right? To pollution centers like to the I-15 corridor. Some schools literally abut next to I-15, whereas other schools are 4.5 miles away. And then when you look at the age of these schools, they range from the elementary schools that are built from 1978 to 2019, for middle schools from 1979 to 2009. And those early dates are the most recent kind of major upgrades according to the school district itself. Again, when you look at, when you look at demographics, we see kind of wide variation amongst economically disadvantaged, numbers of students with disabilities or percentage, as well as kind of different racial and ethnic groups that are in these schools. So our hypotheses are that as air pollution increases, that low-income students will have increased absenteeism rates. And as this kind of the physical infrastructure of these schools, as that age increases, we would see indoor air quality that will vary, particularly due to emissions leakages, the age and type of heating and cooling systems, and that can put populations at risk and increase their exposure. The methods that we will use in this is data collection from these sensors that we'd put on, semi-structured interviews, some GIS modeling, as well as some estimating equations. And we believe that there are kind of policy implications that go beyond, that can inform state policymakers, school leaders, and then the broader research community here at the University of Utah. Thank you very much.
So thank you for the invitation. My name's Scott Collingwood. I'm a research professor and research assistant professor in the Department of Pediatrics. And to clarify, I'm a latecomer to academics a little bit, and I'm not a medical doctor, so I'm interested in my kids, and I actually have grandkids, not interested in your kids directly. Having said that, my training is in industrial hygiene, which is really just measuring things, chemical exposures, air exposures, soil exposures, dermal exposures, any of those kind of things. And I'm a naive researcher when it comes to underserved populations and things like that, and these environmental inequities. A large project that I'm involved in required community-based participation from a wide range of the members of the community. And what I'm going to talk to you about is our friends and neighbors, our Native American tribes in Utah and the Rocky Mountain West. And through my interactions from that prior project, I got involved, and they were, our tribal neighbors were great to work with. They were interested, they were engaging. You know, why does everybody leave us out of research? Those kind of things. So that's how I came about involved in this kind of work. Let's see if I can make this advance. So disproportionate impact in underserved populations. A couple of the key things to note, some of the tribes that we've worked with regionally, we hear things, you know, life expectancies are literally decades lower than ours. And if you think about it a little bit, certainly what you might know about the demographics in these populations may not all be environmentally attributed, those impacts to those life expectancies, for instance. But if you also think about, we've heard multiple times today from Dr. Thurston, Daniel, who's on our panel today, about sometimes those socioeconomic differences and those kind of things make a difference with exposures. I think there's that going on as well. So as I mentioned, we've noted this keen interest in all tribes about wellness. They want to promote health in themselves, and certainly they're forward thinking in that next generation. And their general concern about the environment and how it adversely may impact their health, and little is done about it. And the asterisk there on that bullet point, I would say there's certainly justification for that, right? The University of Utah is home to the largest downwinder study associated with the atomic weapons testing in this region decades ago. The Navajo Nation, who their tribal lands go across 4 states, including southern Utah. I think there's 500 plus abandoned uranium mines and things like that associated with the Navajo Nation. So there's sort of this justification that we know about. So we've seen slides like this throughout the day, just, what are some of the health outcomes and environmental risk factors for those? What I would add to that is we've seen stakeholders and community members from from the different tribes that we work with. They talk about, I have asthma and my child has asthma, but we've lived in this home or on this tribe in this region for generations and generations. You talk to the healthcare providers in those areas and the clinics, and they're not, those clinicians and the reporting mechanisms and things like that may not be as richly mined for data and outcomes as we have, say, here in the Salt Lake Valley. But what they do find is it looks like their asthma rates are elevated. And if they can dig a little bit further, a preterm birth, low birth weight, some of those kind of things that we know that there's potentially an environmental risk factor that's leading to that outcome. And the long-term concerns and damage that may result from that are certainly something important. So their questions aren't without merit. So the strategies that we've employed and that we've engaged with the tribes are to do some pilot projects in hopes of extramural funding around community-based participatory research, build on that community self-identified environmental exposures of concern, characterize those health experiences, and I think as Dr. Riley mentioned, I've heard also a couple times today, sort of that research to action. What plans that are sustainable, culturally relevant, those kind of things that can stay in place and make a difference are certainly important. So that community-based participatory research, as I mentioned, is the tribal lead in identifying and defining those problems and risk factors. That's important to make because we go there with a set of predisposed notions or a hypothesis that we're interested in. But for community-based participatory research, that CBPR, those issues and those things that are important have to come from them, and they don't always align. So be prepared to eat a little humble pie from time to time. And then the tribe needs to take the lead in developing those appropriate solutions for their community. So to report on a little bit of progress to date, we've got pilot projects with 2 of the 3 tribes that we've engaged in heavily. We've seen some of these environmental exposures as certainly concerning from an air quality standpoint and environmental. Radon is one that stands out, something that there's little awareness and education that's going on, but we've got mitigation efforts already in place with some of those. I mentioned the asthma and some of the cancer rates are higher on what we can find reported. And in the partnership with these individual tribes, we're in the process of, in fact, in October, we've got a grant going in with one of these tribes to try and learn more and then also do more about this. So I'd encourage you as researchers, if you have an opportunity, please get involved. It takes a village, it takes a team in bringing the right resources and skills that they need. It is not without challenge. The tribes that I'm working with are not an easy flight, they're a long drive from us, so there's a lot of time and resources just burned up in engaging and getting in touch with them. But look forward to some questions and dialogue and learning from you guys as well. Thank you very much.
Well, thank you for the opportunity to participate in this panel. This is not just my work. As you can see, there are a lot of names there. I'm sure I forgot about 50% of them. There's just so many people that contribute to the work that we're doing. So I just want you to understand that it's not just, it takes, as Scott just said, it takes a village. So just wanted to show this to you. This is usually my first shocker slide. I get people's attention with this. I have a hyper HEPA filter in my house, and just as a show of hands, how long do you think it took to go from the very clear, very clean to when I had to replace it in months? How about 1 month, 2 months, 3 months? More than 3 months. It's exactly 3 months. That's the air that happens that we get. And I actually did see, I think it's right out here where it says, where there's a picture of lungs, and it shouldn't be the filter. Basically, if you don't have a filter and you're breathing this kind of air. So it's something that we really is really pressing to all of us, and we really need to pay attention to it. I'm really glad actually for the panel that was immediately before us, because they did lay the groundwork in terms of spatial differences in terms of exposure. So we want to add a little bit to really the socioeconomic aspects of it. And this is the National Emissions Inventory. This is an EPA product. And again, I'd want to highlight these are just what we call point sources. So just basically a stack. This does not involve road sources or commercial buildings. It's just really what you can consider a stack. And what we can easily see there, so first of all, the panel on the left is your income, and this is the Census Bureau census block level. And what I always like to say about the left panel is that the lighter the color, the lighter your wallet. And on the right panel, we can see the minority population. Darker colors mean a higher percentage of minority populations, and it's very easy to see that the majority of the large emitters are located in low-income areas with a high percentage of minority population. Throughout the day, we've been speaking primarily about PM 2.5 and ozone. Ozone is not necessarily directly emitted. It really comes from a combination of nitrogen oxides and what we call volatile organic compounds, VOC. So that's why I showed those two pollutants there, because PM 2.5 is directly emitted. That could be your wintertime problem, could be your purple circles, whereas your summertime problem could really be your VOCs, your green circles. Now, what I wanted to look at, and I think this is really tying in very nicely to vulnerable populations. I think one of the most vulnerable populations are school children. And this is a project that's still in preparation. We're getting ready to do a final write-up. And I purposely made the font really small so you couldn't really see which school that was. But this is our average. So I just took a random month that was in the winter. So this is December of 2017. These are all the 38 schools in the Salt Lake School District. And the way I color code them is, if you're familiar with Salt Lake City, I take West High School to be sort of our prime meridian. Anything east of that is, I consider east side. Anything west of that, I consider west side. And so the more red, the more west, the more blue, the more east. And you can really see the stark contrast between the exposure modeled at each school. Basically, all the schools that are on the west side have significantly higher, and this language speaking, not statistically speaking, significantly higher concentrations of PM 2.5. As a reference line, you can see the black line right there. And that black line is the one regulatory sensor that it's generally used to determine air quality across the county. You can see it straddles essentially the middle of it, but it's not really truly representative of the entire school district. So that's really the impetus for having spatially disaggregate, much more specific modeled or measured exposure. And what does this really mean in terms of health? It's one thing to really look at exposure or emissions, but one of the metrics that we wanted to use is the association between absences and then the long-term exposure. So what I did here is we looked at what are really the differences between the different schools at the whole school district level, and then looked at 3 different common metrics. And by common, I mean what we can use using our resources here that we have available to us. So we can look at maximum 5-minute exposure, maximum 1-hour exposure, and average 24-hour exposure. And although it's not yet statistically significant, the difference between the east and west schools, you can still see that there is a difference. Again, not statistically significant, but we can definitely see that there's somewhat of a difference there. And lastly, I wanted to show you the fireworks example. This was this past year. And if any of you have been around for more than 3 years, you might remember that fireworks were not always where they are. They used to be in Sugar House Park, and now they were moved to the west side of Salt Lake City, just very close to International Peace Gardens. So at 9 p.m., no fireworks. You can see the air is fairly clean. By the way, it's color-coded to the air quality ratings that we see from the Air Quality Index. And then you can see at 10 p.m., that's when the fireworks start to go off. It starts to spread around by 11 p.m. And you can also see that by around midnight, we start to get some downward clean air from the canyon. That's Emigration Canyon. So that community is starting to clear out. However, the majority of the west side communities are still battling with poor air quality. So I hope to continue this discussion.
Especially excited because I feel like what y'all bring is this real depth of understanding that ecological degradation and the degradation of human health are two sides of the same coin. And not only that, you are able to take a look at it sort of structurally and think about how inequities play into that. So I want to start off with what I think is a somewhat common narrative that lots of times environmental health inequities are really a result of poor lifestyle choices. Seems like your data speaks to that. Can you speak to that a little?
Take a stab, and I guess I would say that. Good to go?
Is that one not working?
So, I would say that as in some, there's this not in my backyard thing associated with some of these exposures and things like that. But at the same token, some of these exposures, radon, for instance, or air quality, in a broader sense, those don't always play a role on socioeconomic or demographic differences. The data that we have on radon exposures, which are an air issue, some of the highest levels of radon exposure are in some of the most expensive homes in our canyons. Those folks generally know about it and get those mitigated. And then I've been wanting to find that with some of the tribal research that we've done, that's where we've started seeing disproportionately large amount of radon exposures. And that's, I think there was a geographer in here earlier, that has to do with the Earth's crust and all those uranium mines in southern Utah and Arizona and things like that on the Navajo Nation. Uranium is the precursor to that. So that's where some of that's coming from.
I have a hard time, sometimes, when we say, oh, if you just change your lifestyle, then you wouldn't be exposed to these sorts of things, and it feels like it's kind of a victim here, right? And so, and I think part of it, when you go into any of the kind of literatures around social determinants of health, around kind of health inequities and whatnot, the interconnections between, a few of us talked about education, but the connections between education, employment, your exposure to these pollutants, and kind of the cyclical nature of this, and it makes it a really tough thing to be saying, maybe we should move somewhere else. And that, I think, kind of limits the, blame that we can put on these populations.
I'm going to run a little bit countercurrent to this, but still supporting the majority of the points that were brought up. I think that too many times people just think air quality, this is something that's beyond my control. But depending on what your situation is, you're probably responsible for between maybe 30 to 50% of your own personal exposure. If you choose to idle your car for 30 minutes right next to where the air intake is for your own home, that's pollution that's going directly into your home. If, for example, you don't, and this is really a part of an education. If, for example, you're mowing your lawn with, let's say you don't have an electric mower, you just have a regular diesel gas mower, but then you choose to have your children around you at breathing height of the exhaust. That's something that really needs to be emphasized. We need to empower people and not just make this be something that, well, you live here, so you're going to be exposed, but also think about personal choices, small things, because otherwise, if we don't empower populations and tell them, look, these are little things that you can do. For example, if you can put plastic around your windows to insulate your house a little bit better so that your furnace runs a little bit less, or you use less electricity to air condition your home, and then that's, you're helping another community because electricity is not generated on site, then small things that can make a difference, a communal benefit, these kind of measures can definitely help. So it's really time to really try to educate populations into small things, enactable things that one can do, but yes, recognize that solving the air quality puzzle is really a much larger, more onerous task.
Thanks. So I've heard then a little bit about awareness and a little bit of like NIMBY and sort of geography factors. I'm wondering then, given that air, when we think about air quality, it's sort of so big and hard to sort of wrap our arms around, why race and class are such predictors of exposure.
Sure. No, but I mean, I kind of alluded to this in my response to the first question. I mean, these things are linked to each other in a lot of ways, right? And so, in public health, we think of, or at least in my training, we think about kind of ecological models, right? Like or these fundamental causes kind of theories and things like that. And so, in a lot of these models and these theories, kind of access to resources kind of is what, or lack of access to resources, and connect you to these chronic conditions. And so, if you, in the case of kind of schooling, if you are kind of disproportionately exposed, you increase your level of absenteeism, or even like as a non-clinician, presumably these things are also having some negative physiological effects on developing brains and on developing bodies, then that can limit kind of educational attainment, employment status, and things of that nature kind of going into the future. And these things perpetuate itself. And so, I think it's really important for us to understand, population-wise, we're looking at in the valley the day that we're having right now, kind of the effect, but with a kind of a particular focus on vulnerable populations.
I think I would echo some of the same things that we've heard today, with some of those socioeconomic issues, with some of the pilot data that we're trying to really look at. It's not just been poor air quality issues, but it's been lead exposure issues, heavy metal issues. We're now looking at water quality and some of those kind of issues. It's all of those things seem to compound on that. One of the earlier panelists talked about not having access to grocery store within 2 miles. Or and I should say the work with the tribes. This also applies to our rural frontier populations. When I was reading about a definition of what a frontier population is, one of the things that I remember about that is, in our area, there can be more animal over 1 mule deer per square mile of people. I mean, they would love to have the grocery store within 2 miles. It's, in many instances, it's an hour or 2 drive on 4 roads. So there's all kinds of issues going on here that complicate the problems.
I guess just a quick thing I'm realizing as you're speaking, Scott, is that when we think about sort of tribal geography, You can get it over. I was just thinking.
No, and absolutely right. And I go into, when I'm working with the tribes and the community members and leadership, I just come there humble and try to focus on one problem at a time that we may have an opportunity to impact. But yeah, there are larger problems at play. But that's the other thing too to be mindful of. We're talking about radon exposures. The latency and the medical doctors can better explain. But you're talking about radon exposures that may lead to lung cancer in 20 years. Lead exposures that have these developmental disorders, unless they're exceedingly high levels, that impact our children, and the permanent impacts to our children and their children in years down the road, and those impacts can be permanent. But you also have to balance those against, other substance abuse issues, domestic violence, or access to decent food, those kind of things. So you also, we come in here without ideas how we can do this, and then I've been frustrated at the rate of implementation or action and things like that. But again, it's what are their priorities and things like that, recognizing that there's other factors impacting a lot of those things.
I think it was all said very eloquently. I think the last piece that I would like to add is that generally exposures are fairly collinear in the sense that this was a really good example that was brought up in the previous discussion, looking at air quality and the sound barriers. Because if we're looking at an interstate highway, for example, and there's not a sound barrier, then not only sound spilling over into neighborhoods, but also the pollution from the cars driving on that interstate, which would otherwise be trapped by a sound barrier or by a wall. So thinking about not just one potential environmental hazard, but then also the lack of resources such as food availability or even medical care availability in some communities. So all of these factors really just play into a role. Air quality is a significant factor, but it may not be necessarily the only factor or even the driving factor.
Great, thanks. I appreciate this, hearing both about kind of the complexity of these issues, the structural nature of them, and also sort of how disadvantage accumulates, right? That's what we're looking at and talking about in some interesting ways. So I'm wondering, and Scott, not to pick on you, but I'm appreciating that you enter into this work with the sense of humility that you mentioned. And I'm wondering, as you all think about what has happened in other communities, are there other functional approaches that we've seen play out in other communities in terms of dealing with environmental health inequality? What do we have on that?
I don't know that I have a good answer to it addressed directly, but I guess I would say that our tribal partners, they are. I would encourage researchers in the room to reach out. They, from an NIH standpoint, they're underserved, under-researched, under-resourced populations and things like that. So they're by and large, they're clamoring for involvement. They want to be involved in our research projects. There's a few extra layers of administration and bureaucracy on top of, if you're dealing with a sovereign nation. So you're sitting down with the business council, the tribal council, that's their cabinet, and the president of their tribal nation, things like that. If you need approval from to do these projects, but they're very willing participants wanting to engage their housing department, their health departments. There's community champions and stakeholders in those communities and neighborhoods that more often than not somebody that will rise up and want to come alongside and carry the mantle for you within their communities. So I guess I would just encourage to make those connections. Because I've seen much of the same thing with research in Salt Lake Valley and Cache Valley. To get this community-based participatory research done, it takes not just the university side, but it takes those community members and those community organizations to get involved. theirs were some of the similarities that occurred with those same leaders that were trying to partners.
I think we need to be realistic and as Scott mentioned, we need to be humble and really understand what community needs are. And part of the reason I didn't originally really work with much community engagement or community outreach, and I think it really started when I went to a couple of these clean air festivals that keep on happening fairly regularly, and it was just generally one person would speak for a little bit, and their punchline was, buy an Easton Leaf or another electric vehicle and solar panels, and we're going to save the world together. But that's not really applicable to all communities, particularly disadvantaged communities. I mean, it's applicable to a small percentage of people. And that's when I realized we can't just, bludgeon into communities saying we have the answer. And really we need to understand, engage with the communities. That's why it's not outreach, it's really engagement. It's really working as essentially an ambassador, trying to learn what their needs are and trying to see how your own organization, in this case you, can best serve them and best help them. One particularly proud moment for some community engagement work that I've done in conjunction with the City of Salt Lake is we have established 2 annual events, and they're the Breathe Clean Festival and Environment in You, where we work with West Side communities. And again, just going back to my original statement from the first part of the panel, where we didn't just say, hey, buy an Easton Leaf or electric or solar panels, but here are some window installation kits. In conjunction with Utah Clean Energy, here are some LEDs that you can put on your house and decrease your electric bill right now. Here are some breathing masks, for example, or here are some additional pieces of installation. We're now working with low-flow shower heads. These are things that people can actually grab onto and see an actual change. They may not be able to clean up the freeway pollution, but this is something that they can feel, they can actually see that the change is happening. We also encourage all participants to provide their literature in both English and Spanish. We have a large Spanish-speaking population. We also have other minority groups, so we need to not just come in with an English brochure and expect everyone to read it. We also need to understand that for a lot of these people, they don't have the luxury of just taking 2 hours off their job. And maybe what happens with their kids, they may not be able to afford babysitters, so we actually have childcare at our events, and we also have a person who's a clown and makes balloon animals to amuse the kids so that parents can kind of absorb the information. So we really need to understand what are the demographics, what are the populations we're working with in order to make these solutions actually work for the communities we're trying to work with.
I think the only thing that I would add to this discussion, so I've only lived in Utah for just a little over a year. I recently moved here from Michigan, which has had issues around not only air pollution but kind of all types of pollution. In my work and just in my kind of everyday experiences, I think we have a lot of discussion around kind of the community outreach and community engagement. But I also think that, and this was touched on in the last panel, it requires state, local, federal, non-governmental, religious organizations, university researchers, coming together and being able to kind of identify and work together to address these sorts of things. Because I think singularly, I'm not optimistic. But I think kind of by bringing kind of disparate organizations and groups together, I think there's an opportunity here.
That's great. Well, I think we have a little bit of time for audience questions. So, anybody have any? I think they're going around the mics a little bit.
Great discussion. Regarding, say, the future growth of the population in this region, Salt Lake and Utah, obviously, as the population grows, there's going to become more industrial infrastructure needed to support that growth somehow. So I'm thinking like the instance of, I need to build a house, there needs to be a concrete plant to be able to support that house growth, right? And so given that context, how do we address the environmental, social, and can't remember the last one, justice issues with respect to industrial locating industry in community, economic justice as well. So you have a concrete plant. I come in, I'm the owner of the concrete plant. I go, okay, I'm not going to be able to put that up in the avenues because they're going to get a lot of fighting. Because all those people have a lot of money and they'll hire lawyers and they'll fight me. So I'll go and I'll put it into a lower economic neighborhood because I won't get fight back from people because they won't have necessarily the resources to hire lawyers. But then also I'm bringing jobs. And so the literature has shown that there's this complicated action of you bring in economic opportunity. It might not be clean opportunity, but it's opportunity, and that the lower income neighborhoods might actually embrace that because it's jobs. So you guys make some comments on that?
I'll make some comments in that the economic realities of that, again, with respect to some of the rural frontier and tribal communities that I work with. One of the things that I hear early and often when I get engaged is they're interested in health, they're interested in wellness, they're interested in environmental exposures, they want to know if there's an issue, they want something, they want the knowledge and the ability to do something about it. But it's also been very clear in several of these tribes are I'll say engaged, I was going to say entrenched with oil and gas and resource extraction type things. I mean, they very much benefit economically, and that's a major economic boom in those tribes. And they don't want that impact. It's how, really it's, and this isn't a bad model, it's how would we work together. So I guess that's one thing that I would say is your example that you pointed out with that potential of that cement plant going in a more economically challenged area. That may be a welcome addition. I mean, that's something from a research standpoint that you might have to be prepared to deal with. I guess my quick thinking answer to that is it being policy type decisions on rules and regulations that say what should the emissions be and so on and so forth. Other states have requirements that schools can't be next to major roads and things like that. So there are some policy type things that may help address that and spread some of that, ensure a lower environmental impact and things like that. That might be the right way to go.
Thanks for that. I think, it's an interesting thing too, because a lot of the history of environmental justice is people sort of standing up against that kind of thing and coming together under that. But your point of sort of the economic forces to play, and then so what are the role of policymakers and how do we listen to communities and as legislation, the answer there I think is a great reason why it's so important to get all of this together to look at this. So thanks for that. Any other questions on that?
Great panel. Thank you very much for educating us all about this. One of the things that I have been struck with as a researcher in this field is when we are looking at exposures, and we just make the presumption of, some of us make the presumption of outdoor air exposure being equally, if not equally distributed throughout the valley, which everyone has shown is not the case, but is it equally distributed within the home? And so indoor versus external air exposure. And that I feel also may potentially have a financially disproportionate component in terms of filters, in terms of efficiency of various appliances and those kind of things. I'm just curious on your thoughts with that.
so much with tribes yet, it's not yet published work, but we're looking at the variability of indoor air quality exposures in homes in the Salt Lake Valley or shore. There's exceptions to everything. In general, homes tend to act as an air filter for outside air, so that's, in general, that's a good thing. But we can have point sources of pollution and other activities in the home that can lead to potential harmful exposures. So, the base answer is it depends. But one of the things, and again, this university and folks in this room that presented earlier today are doing a great job of developing low-cost sensing technologies that give us the ability to put, in our study, we put 10 sensors inside the home to look at the variability. We're collecting housing characteristics and what's the human density in that home, size, and so on and so forth. Trying to get at either a model that fits or tells us a little bit about those kind of things. But it's important. It's important to recognize that the home can be a respirator, so to speak, for poor air quality outside, but it has to be constructed properly, maintained properly. Back to the environmental inequities that takes resources, money, knowledge, time. So those can be challenges as well. So.
Yes. See if I can add something good to that. Well, one thing that we also need to consider is whenever we look at the majority of what has been shown today, this is outdoor. And I'm glad you brought up the indoor component because it does cause significant variability. As Scott just mentioned, it can vary across the home based on home construction. But there's another element to this. There's also, we've seen a lot of discussion on PM 2.5, but actually earlier on there was a little bit of a discussion as to the different components of the PM 2.5 when there was a discussion about the desert sand, etc. And that's part of what we're looking at. We've installed sensors inside and outside an office building that's actually run by the state. And we see seasonally that there are differences in terms of indoor and outdoor PM 2.5. And the suspicion is we really looked at three events: wildfires, an inversion, and fireworks. And inversions, as was discussed much earlier on today, a large part of the inversion PM 2.5 is actually chemically bound. It's part of a chemical reaction. It's not necessarily primary. It's not something that's directly emitted. And so when it changes environment, meaning when it goes inside an office building where there's potentially higher relative humidity, definitely higher temperature, we actually saw those levels of PM 2.5 drop. And we think it's simply because it just goes back to its initial chemical components. With wildfires, not so much. Wildfires are actually smoke particles. They're actually a thing. It's not necessarily that it's been chemically made. And so we see those levels actually be somewhat higher, meaning they're still lower than outside, but the home is less of a respirator. Really, I'm going to borrow that term, actually. And with fireworks, we saw a mix of the two, because fireworks are really low. If you're actually burning something, so you actually have the smoke, but then you're also creating some chemical compounds that are PM 2.5. So we have to distinguish so many factors now. What is the source of the pollution? And then the type of building entity that we're looking at. So these are really great avenues of research that we're actively conducting.
One more question.
Probably more of a comment than a question, but really appreciate this panel deeply. And I think, one of the things I like Daniel giving his hope on this front, things that can be done. I think for any of us who joined an actual fight out there in my neighborhood, which is a pretty class-diverse neighborhood, we fought Rocky Mountain Power for about a year and a half because they were trying to expand the power station right behind our house and in the midst of all of these houses, including cutting down trees over the trees that had the most birds in the neighborhood and so forth. And one of the things that I found with that is we all got educated. And it seems to me that's partly what your panel is saying too. There's so many ways for us to get educated on this front. But joining a very specific fight, you get educated very quickly. to find out why things are the way they are, and why it wouldn't happen in the avenues. We had a really interesting experience of trying to organize people across many different class lines and professional lines to do that. And in the end, what was interesting, we tried the argument from a kind of university perspective to say that they were running an experiment right in our backyards, without our consent. And they were running the type of experiment that no IRB board would ever let you, run, which is say, let's run an experiment. Let's pretend that all the parents in the neighborhood say, yes, we want to put our kids forward to see if there's an increased case of childhood leukemia with greater exposure, to electrolytes or whatever. And, if you put that in with parental consent, you would never get that through an IRB board. But these are the experiments that are being run by the state and by the city and by Rocky Mountain Power in our backyards without our consent. So I would just say from my one experience, getting involved in all the different aspects, of a specific fight is deeply educational. And it very quickly takes away the we, them that we often get caught in, whoever we are, environmental circles, to understand the parameters of environmental racism. I think that's profound, and I thank you for bringing this up, because I think environmental racism is really the issue of our time, and that brings together two things that I know Adrian has a heart for this at the university, trying to make sure that whenever we talk about sustainability, equity is in that conversation at every turn, because these issues are so wound around each other. And I think your commentary just beautifully illustrated that, so thank you.
All right, well, thank you all so much, and thank you all for engaging and listening and being thoughtful. And I think we're going back to you, imagine.
Yeah. Let's thank our panel again, please. All right. So, Catherine, thank you for the segue. Part of what we're trying to do with this activity, we live in a small city that has over 50,000 people coming and going in a variety of different roles. And as part of that, oftentimes these connections, these relationships, this education of all of the different facets of these problems get left behind, and we don't celebrate the great work, we don't try to catalyze new work, and we don't educate. Oftentimes we're just missing some certain information about what is available here at the campus. So part of this is to look at this from a multidimensional way, to see these different lenses that we can look at it that create opportunities for further engagement. The other part that came out today that I would like to give a few minutes for is part of that education piece. There are innumerable resources here on campus that can help us connect and move this work forward. And so I just wanted to give a couple people an opportunity to share some of those resources and centers that are doing some of this work that some of you may not know about very quickly. So again, there's the research group, the university research group that I think has some opportunities and some resources that we can use as researchers. Would you like just to speak really quickly?
Identifying funding opportunities. We have two PhD technical writers that are just terrific at taking this science and making it a compelling story for internal seed funding proposals or for funding proposals. Melanie is one of our, right there, Melanie Steiner-Schulig. And we also do a lot of work with building interdisciplinary teams. We've done a number of meetings similar to this, the baby-sized version, where faculty requests meetings to identify collaborators for disability research. We work with carbon capture. These are ideas that faculty bring to us and want to have build interdisciplinary groups, particularly across both campuses. And interdisciplinary groups. If you have an idea, let us
Thanks. Rick, I don't see Ken here to talk about Nexus.
Yeah, I wanted to, Ken Smith is the director of Nexus. He couldn't make it today. I'm on the executive committee with Nexus, and Nexus is an interdisciplinary organization to help foster research across the university. We physically have space in the new Gardner Commons building right next door, and we've got project room space there. We have a coordinator who can help you schedule meetings, get close to. We work very closely with the engaged group at the Research and Development Office. Once you have a team together, we can work with you. Our coordinator can schedule the rooms for you, send out reminders, keep people moving on their projects. We also have seed grants that are available. You'll be seeing something coming out later this fall, announcing some interdisciplinary seed grants that we'll be promoting. And we can, this group can be found at the webpage is just nexus.utah.edu.
Great. Thanks. Brenda, GCSC.
All right, how many of you in this room have done something engaged with the Global Change and Sustainability Center? So if you're not one of the people raising your hands, hopefully you're thinking, what is this? It's a network on campus. It's been around for 10 years, and it's the themes that we're talking about today are things you care about and things you want to keep working on. This is what we do all the time, and so we're a network of scholars around campus, about 150 faculty spanning all colleges and programs, and really try to just bring people together. We have graduate programs, a graduate certificate program in sustainability. We have seminars, and many of the things that were identified this morning as key things to keep doing to grow our interdisciplinary research community is the work that we're trying to do and promote around campus. So environment.utah.edu.
Great. Well, we'll stick over on this side. It moves to students. So the SCIF fund through the Sustainability Center.
So yeah, for those of you that don't know about the Sustainable Campus Initiative Fund, it's a big chunk of money that's made possible by students. They've sort of invested their own money for a decade now to try to move the sustainability needle on campus. There are many different levels of that, including a revolving loan fund that's focused on efficiency and things like that. And SCIF pairs well with many other funds, so we can collaborate and be friends and really do some great work. So
fantastic.
just look us up, sustainability.utah.edu, or just Google SCIF.
Fantastic. Alexis, do you want to talk about?
Wellness?
Yes. The resources.
Yeah. So I work with Dr. Marcus, who's on the last panel, so we work on wellness and integrated health. So we try to support a variety of different sustainability and, in today's case, active transit policies here on campus. So if you have something that you feel like relates to wellness, you can always reach out to our office. Our email is wellness@utah.edu. Just send us an email. We also have a seed grant fund that's going right now. It's specifically for those who are up in the health sciences, but if you work in that area of campus and you have some ideas about ways to make your area more well, or kind of bring wellness, or active transportation, or gardening, or who knows, anything kind of that extends beyond just the theme of air quality, you can find that information on Pulse if you work here on campus. So, yeah, thanks.
Cool. Anything else I'm missing? No? All right. Well, thanks for sharing, because I think it's really great. Oftentimes we get in our bubbles and we don't view the world of opportunity that exists outside of where we typically stand. So that was great to understand that. And so next time you're thinking like, boy, I wish I had a little seed funding to do this project, you have heard about several of them, and there will be more. So now we want to shift, and I think it's to capture, I want to bring up George and Rob. I'm calling you by your first names. We've spent so much time together today. And just sort of lead us through a little bit of discussion about what are themes that they saw. And then maybe get some input from you all, and then we'll shift over after that to the reception and looking at all these amazing posters that are around and talking with the presenters there. So,
thank you.
yeah.
Well, I just want to say how impressed I was today with the really broad diversity of research that's going on here, and how many possible interactions I saw between the different people, and points of interception where they could react to each other. I mean, how many people here saw something discussed and said, "Hey, I didn't know they were doing that"? How many people said, "Okay, yeah"? So, and then how many people thought, "Well, maybe I'd like to collaborate with that person," And not as many, but almost as many, really. And I was going to ask, how many people thought, and I'm not asking this question, I'm an expert in that, why didn't I get included? Don't answer that. Okay. Anyway, I know there are some of you out there. Because this is what this is about, which is trying to get people to learn what everybody else is doing. And I was thinking, well, how could they keep this going? And I thought, what's really needed is like research Tinder. Get everybody on there, and you want to work with them, so you swipe right. There'll be no swipe left, okay? Because that's that. But then I said, let me Google this, and of course it already exists. Other places have this. So anyway, I think that one of the things that could come from this is increased interactions and using the resources that are here by knowing about them. I'm at NYU, and this is a pretty big school, but it's like half the size of NYU, but it's, I don't know, 3 times around that I went to. So, I think that the problem I've had at NYU is it's just so big, I never know what other people are doing. And there is redundancy that goes on. So I think that you could be optimally sized for this, because not too big, not that NYU's too big, So anyway, what about themes? One that I heard was children, because they seem to be, of course, everybody cares about children, and there's a lot of people doing research related to children or outreach, and how the science can interact with families. I know when I had, I still have kids, but when I had younger kids, we were always looking for something to do, and so I could see that as an avenue to have activities on the weekends that would draw, maybe come in and do maybe PM samplers or something, and maybe do some art. I did see one thing, it was sort of just quickly mentioned, and I've seen it before. Someone at NYU has done this, where they actually filter the air and get the soot, and then they use a little sprayer and they do artwork. So you could do drawings of the kids' faces, but it's all pollution. I don't know.
Rabiki Labs.
Huh?
Rabiki Labs out of MIT does that.
Does that too? Yeah. So I think there's a number of people, who do this. But I think that's kind of what we're getting. But also in the research end, there's a group that where they're doing the growing, and they're the most impacted, and they have the most to gain from not being exposed. For me, it's a little late, but not that I do worry about exposure, but I think the children are a focus that I heard a lot of people. So I think that's something that across all of the topic areas. I think your turn.
So really a very exciting day. Again, Jim, thank you for this. Thanks to the Senior Vice President pushing forward, because I think we've all enjoyed it. And as George was suggesting, lots of new insights, new ideas, and thoughts. I started writing down maybe different things, and I wrote 2 minutes. Lots of stuff going on. I will say I'm impressed with the incredibly rich data set exposure we have here, and our challenge is to figure out how to use it most effectively. How how to get from down here to up there and link main campus and some of the information there with health sciences, but also take this step further. George mentioned this morning, we move beyond just mass assessments of particulate matter to actually different kinds of particles, different volatiles attached to the particles, and understand some of those health implications. That would be a wonderful step that would be well positioned to, it would be uniquely positioned.
I'm glad you said that.
I think, you know, we've talked about kids, we've got some geriatricians here, susceptible populations. We don't understand the susceptible populations very well and how the different pollutions impact those. Great opportunity in building on the theme of children. The single thing that, actually, two things we've heard so much about. I think behavior change is the holy grail. We don't know how to do it, but those of us involved with air pollution, either on the biology side or on the exposure side, haven't pulled in the right experts to figure it out. So I was very excited hearing our political science colleagues, the panel this morning, and some of the conversations this afternoon. And I think we need to really grab that opportunity and to try to understand, to do some science of behavior change, not just wishful thinking and communicating more effectively. Then another big theme was around costs and benefits and the economic analysis, the difference between short-term and long-term effects. Ties a little bit to behavior change. It certainly ties to enormous issues with social justice and the fact that environmental exposure around here in many places is really part of the burden of difficult socioeconomic circumstances, often ties to racism. We need to be pushing on all of that. So I think that in the panel this afternoon, Professor Singer made a point about this singularly. He's not very optimistic. Because if we pull together, we might be able to accomplish some great things. I think that's really the theme of the day. I would urge you all to go home remembering that.
Yeah, there was one other.
You got one more.
Well, okay, I'm going to go obscure a little bit. But one of my favorite movies is Starman. Starman. It's really great. Jeff Bridges is in it. And it's from years ago. It's worth a watch. One reason I love it is because the scientist is not the person who creates the bomb that's going to blow up the world. Actually, the scientist is a good guy. Okay, so I highly recommend it. But in it, you know, there's an anthropologist and he talks to me, and I'm going to spoil it here, but he says, what did you learn about us as a species? You know, because the starman is from another planet. And he says, well, you are at your best when things are at their worst, which I think is true. Anyway, but so well, there was a lot of mention about bringing people together, and one of the issues that came up is that was making me think of 9/11. Sorry, but it was this inland port. First of all, I don't see how they're going to get all that water here, but that was something that people were all discussing, and that sounds like a very complex issue and needs some independent assessment, and that could be a theme that you know that we could do as a group, as a service to you know try and say, okay, here's our experts. I mean, we did after 9/11. We had a forum because the government wasn't talking much, and so we brought in all the scientists and talked about it and answered people's questions. We invited the government people, but they didn't want to come there. But so I think that in issues like this, really the scientists step up and the physicians and so on and say, look, we don't have a dog in this fight, but this is our opinion and about this, and have some analysis like the cost benefits you just talked about, looking at the dollars and the health and so on. And that seemed to come up a lot, you know, occasionally in the conversation, and then at lunch, people were talking about it a lot.
It is, as everyone knows, it's a very hot item. It's all over the press. It is, I think, a great thing for us to again, as, shall we say, as objective scientists, simply developing some data and trying to do a more sophisticated analysis of what it will all mean.
Great. So I was going to open it up for a bunch of conversation, but I think that can happen during the reception. And so I guess there are just a couple things in my practicing of gratitude. So first, I want to thank all of you all. This is not my area of research. And so it's been really rewarding to see that so many people are willing to spend a portion of their day, spend all day, a long day, really engaged in this topic and spending significant physical energy as well as intellectual energy at solving this vexing problem. So I just first want to thank you all. You really should be applauded. And as a representative of the administration working with Dr. Reed's office, that there is a commitment from the university to see how we can help facilitate this, coordinate it, so that it does reach out into the community and really makes an actionable change and that we can see. And I think this is kind of the start of this, and it's really to galvanize all of the efforts that you all do, that you spend a lot of your time doing. So thank you. The next group, so, people have thanked me, which is kind of ridiculous in the sense that I just have been working with an amazing group of people to put on this type of event. And no, you can't go anywhere. I can't go. You're staying there. And really, I was teasing them earlier that if it was left up to me, we'd be in some crappy little room with a slide projector, and it would not be much of an event, and we would not have much participation. So there have been innumerable people who have helped put this on, and I Laura, Cassie, Jeanette, Leslie, GCSC. There have just been so many people who have helped coordinate all of this. So thank you. Then there is the scientific organizing group that really came together, that's been doing this work for a number of years, and they really set this all up. So thank you. And then last but not least, I can't offer you guys swag. We had an anti-swag policy, but it's excluded for George because he's not a university person. So we know you like coffee. So you can take this, you can use it on your next flight in your 12 time zones or whatever occurs.
Only 10.
Okay. Well, next you'll have to go for the record. And so we thank you for coming to Utah,
you're welcome.
to share your expertise and be willing to spend time.
Thanks for putting up with my little stories.
Anytime. So now with that, we'll break, and I encourage you to go look at the amazing work that's being done with all the posters. It represents all around the campus, and thank you.